All right, so this is not a PowerPoint, it's a PDF, so I got to use the cursor to man it. Here we go. How do I navigate up and down with this? Hold on. I think I could just use a cursor. Here we go. Hold cursor. Okay, it's an honor to speak here at the North American Spine Society facility. My name is Dr. Philip Yu. I actually trained here in Chicago for my doctorate in chiropractic medicine, which I've retired from. Right now I'm working on my PhD in stem cell biology from the Panama College of Science. I'm actually going to present this book I'm working on titled Star Tech Stem Cell Signaling. And the reason it's not a blunt book about like stem cell therapy is it's probably not wise to blatantly advertise you're doing cellular medicine with the FDA guidelines, but I think I could fully talk about the signaling mechanisms of how we stimulate your body's autologous stem cells to proliferate and regenerate. So I'm going to talk about different ways to signal stem cells to do just that. Stimulate your body's healing mechanisms to heal thyself. I can get this. Here we go. So I'm honored to achieve diplomat status from our great American Academy of Stem Cell Physicians. I still have to finish up my fellowship at the American Academy of Anti-Aging Medicine. All right. This book is forwarded by Dr. Klotz, who founded A4M, so it was an honor to have him forward the book. Again, disclaimer, this is not to say we are curing, mitigating, treating disease. It is just my research findings on these protocols. This book is dedicated to our former medical director. You met Dr. Gooch. He's our orthopedic surgeon. He left the earth a few months ago, but it was an honor to have him as our medical director. Our new medical director is Dr. Chiriano, vascular surgeon here today. Say hi to him. This is a past A4M event where I brought the NFL Alumni Association over. We treat many of their clients, so we still have relationships with the NFL alumni. All right.
Was past A4M, was past A.
AASCP, yeah. This book is also dedicated to the greatest healer of all, in my opinion. Jesus did so many miracles, made the blind see, the lame walk. In fact, he performed so many miracles, it's said there's not enough space in the world to write the books about the miracles he did. I also support the Navy SEAL Foundation because they keep our country safe. If you live in Pennsylvania, please support Dr. Oz. He's a big fan of alternative medicine. This is my family. And I'm the past wellness director of the NFL Alumni Association in San Diego. I've always been fascinated with human physiology, structure, and function. My BS is at Michigan State University in human performance. And I've always been interested in longevity and wellness and human performance. So the question of the century is what is the fountain of youth that Balboa and Cortez tried to find in South America and southern United States? Well, I think there's two schools of thought. One is pre-programmed aging, where the lifespan of the current human is limited. And then there's the theory that aging is disease, and if you could treat it, you can live forever. Well, in my opinion, I think aging is actually pre-programmed, where we can use regenerative medicine to stave off disease and dysfunction, and your later years don't have to be in a wheelchair with, brain degeneration and, chronic pain, loss of vision. If you do look at the Old Testament, Joshua says at 85 years old, he was just as vigorous as when Moses sent him out. If you look, Moses was 120 years old when he died, but his eyes were not weak and his vitality did not leave him. So either he had an SPG block of exosomes in his eyes every day and he had stem cells IV'd, or, we're not meant to be disabled, and our lifespan seems to be about 120, okay? So I was sitting having lunch in one of my practices in the Palm Desert, which is a bunch of baby boomers and seniors. They all golf out there, and I just noticed they were either limping in a wheelchair, like one guy was in a wheelchair and his wife was feeding him, or they were disabled. And it doesn't have to be like that. And I think one of our missions is to take these suffering baby boomers or seniors and disabled athletes and have them live functional, pain-free lifestyles at the end of their careers and their golden years. So that's one of my missions. So back pain is the number one cause that someone will visit a doctor's office. And as Warren mentioned, there are different phases of the degeneration. If you look at the disc height, obviously, when the disc height does collapse, you can see in the late stages of degeneration, you got hyperlordosis, bone-on-bone disc degeneration, compressing the nerve roots. I have this one interesting case study. This is a guy, he's about 50 years old. You can see L5S1 is degenerated, all right? Chronic back pain, 10 out of 10, severe sciatica, peripheral neuropathy. Now, Warren mentioned it'd be nice if you can see physiological changes with the relief of symptoms. So this is not an intradiscal injection. We don't have that set up. This is actually injection of 4 cc's of Wharton's jelly in the urinary bladder points in acupuncture. I got my acupuncture certification right here in Illinois. And basically we're targeting the multifidus muscle with the theory that because the multifidi muscle, which basically attaches to the SI joint, sacrum, the mammillary processes, and the SPs, with late-stage degeneration, they're going to shorten, theoretically pulling your spine in more degeneration, but regenerating the multifidus muscle, they begin to lengthen and strengthen, and I think that's why L5S1 actually has increased space by regenerating the multifidus muscle. There are evidences of injecting MSCs in sheep collapsed vertebra that you can recover normal proteoglycan levels in the nucleus pulposus. Again, that's a sheep study. We'd like to do a human one. Who has 100 million? Let's do it together. I don't even know if it's human MSCs. I'm assuming it's sheep MSCs from the bone marrow. Yeah. And then we have a lot of neurodegenerative disorders. A lot of doctors prescribing statins, and the amazing thing is not because their LDLs are high, they're telling you it prevents heart disease, right? But we all know that the problem with statins, they shut off your production of cholesterol, which you need to make hormones, especially females. You need to make the myelin sheath in the brain cells and the peripheral nerves. So I think there's a correlation with the prescription of statins increasing. We also get an increase of prevalence of neurodegenerative disorders such as short-term memory loss, Alzheimer's, blah, blah, blah. It's just a correlation I'm finding. I'm not claiming anything. Plus, you kind of need cholesterol to make the cellular walls of your hormones. Dr. Alt in Germany, he's the one who did stem cells for Jack Nicklaus, the golfer, and got him out of back pain. They did a study there and found that atorvastatin, simvastatin actually prevents your body's stem cells from proliferating. Because again, the cell walls are made of fat and cholesterol, and you kind of need that. We had a patient with peripheral neuropathy. His feet were numb for 10 years. It was idiopathic. He wasn't type 2, didn't have chemotherapy, wasn't on statins. After one injection of biologics, I believe it was Wharton's jelly, in the peripheral nerves, the peripheral nerve pathway, superficial peroneal nerve, the tibial nerve, and the deep peroneal nerve with some shockwave treatment. His foot numbness was 80% better, and he could feel the bottom of his feet for the first time in 10 years. So obviously regenerating the myelin sheath is the key to get peripheral nerves to regenerate. I believe some of my patients, they tell me, well, what alternative to taking statins to lower their LDLs? Well, I believe that phosphatidylcholine, which is actually part of your cell walls, your stem cells and all your cells, is made from lecithin, from soybean oil. And it's kind of funny, that's what Pam cooking spray is made of. Now, why do you put Pam cooking spray on your fry pan? So it doesn't stick. So theoretically, if you supplement with lecithin, phosphatidylcholine, it'll keep the plaque from sticking to your arterial walls. I think our number one enemy is the opioid epidemic. It causes well over 100,000 deaths a year. This is another mission to get people off opioid addictions. A lot of these companies, they make opioids to be addictive. Case in point, OxyContin. A lot of teenagers take opioids because they do it not because they're in chronic pain, they do it to get high, right? And a lot of these opioids that the teens take are sold on the streets. Counterfeit Vicodin, and now we have counterfeit fentanyl, and it's a deadly combination. So we kind of have a dumb border policy because that's where the drugs come in through, and they're manufactured in China. So you know they're impure, you know they're not very safe for you. So our mission is to get people out of chronic pain and off the opioid addictions. All right. Again, very proud to be part of the Academy. So I encourage you to attend your workshops and take your diplomat exam. All right. Again, I was talking about the addictions of opioids. And then, of course, we know all the side effects of taking NSAIDs, non-steroidal anti-inflammatory drugs, you know, your Motrin 800, your Advils, of course, causes GI bleeding. That's not an answer to chronic pain as well. And then you have your, anti-seizure medications, which are given off-label for nerve pain, such as gabapentin, Neurontin, Lyrica, Cymbalta. Those come with their side effects as well, such as respiratory symptoms and seizures, ironically. So again, peripheral neuropathy is growing, but the key is how can you regenerate the myelin sheath to get rid of those symptoms? So I feel that we specialize in failed medical cases, patients who failed on pharmaceuticals, cortisone epidural injections, and of course surgeries. So a lot of times when we should be the gatekeeper, the first line of defense, we're the last. So you need every tool in your kit to get these failed procedures, these failed medical cases out of pain and dysfunction. So the more tools in your kit, the better. That's how we're here learning about this. Just like Warren presented, just because your L4-5 disc is bone on bone on an MRI or X-ray, it doesn't mean that causes back pain or sciatica, because more than 50% of males over 40 have degenerative disc but no symptoms. That being said, without knowing your neurology, I think there's a lot of failed cases. Like, let's take the knee, for example. Let's say your knee is degenerated on an X-ray or MRI, and you're scheduled to do meniscectomy or even a knee replacement. Well, what if the bone-on-bone knee wasn't the cause of pain? What if you had compression of your femoral nerve, L234, which was causing your quadricep muscles not to fire correctly, so the tracking mechanism was off, and you wore your knee out? Well, sometimes regenerating the femoral nerve can improve your quadriceps health, keep the knee strong, and prevent it from degenerating. This is actually often a nerve it's actually injured during a hip replacement because you got that anterior thigh neuropathy or pain. So finding the neurological level of the lesion is the key to successful therapy. This patient had a Baker cyst, degenerative disease of her medial knee. Actually, she failed with Wharton's jelly, but for some reason she responded to cord blood. So again, the more tools in your kit, because you probably need more angiogenesis more than cartilaginous regeneration. All right. We use a lot of light-emitting diodes and class 4 lasers. This patient had peripheral neuropathy, numbness, tingling, loss of balance. You can see with this infrared thermography scan, the before image shows lack of blood flow, low temperature, and after about 6 laser therapy, light-emitting diodes at 650 and 810 nanometers, blood flow is restored, normal temperature 98.6, and guess what? He can feel the floor, numbness, tingling is gone. So it's not always about injecting biologics. You can use frequencies of light, electromagnetic fields to regenerate the body. The book just keeps on getting longer and longer. I just got to print it. Warren mentioned about these failed fusions. Once you have it in one spine level, let's say L5S1, L4-5 is going to degenerate too because L5S1 is fused, doesn't move. L4-5 overcompensates, too much mobilization and wears out, and then it's like dominoes. I had a guy literally from like C1 all the way to L5 was totally fused. And then he shot a 9-iron and one of the screws broke. So what can you do for that? Not much. Again, I know one of our NFL friends, Emmitt Smith, Hall of Famer. I'm going to teach you how to educate your patients how a stem cell works. I tell them, I don't really use the word stem cell. I just say your cell is like your reparative cell, your medicinal signaling cell, MSCs, is like a fireman. So let's say that knee represents your home and it's on fire. You see the word flame, inflammation. So how does it looks like a fireman's helmet, right? If you're looking down. How does a fireman know to go to your home, Mrs. Jones? Well, there's a signal, there's a smoke alarm, and then there's dispatch, which calls the firemen to go and put water to get rid of the flames of your house. And then Bob the Builder comes and rebuilds it. So I tell them, well, if your knee is bone on bone and it rubs, it causes friction, heat, swelling, pain. That sends a signal for your body's autologous stem cell to go get rid of the pain and inflammation, and then your cartilaginous stem cell goes and regenerates it. So that's one way you could easily talk to your patients about the signaling mechanism of stem cells, and not you're injecting something and it transforms into tissue, which it really doesn't work like that as far as adult stem cells, because they're already predetermined to differentiate into these types of soft tissues like fat, muscle, bone, fat, and cartilage. Again, I always tell the patients that, why do athletes retire at 30? Because your stem cells really take a dive, and after 50, everything falls apart because your stem cells fall apart. This is great. This is a study done by our very own AASCP orthopedic surgeon member, Dr. Joseph Parita, was part of this study. So if you're not familiar with the FDA guidelines, how can you use allogeneic biologics in your practice? So there are 3 qualifications for what's called 361 guidelines. One is minimal manipulation. You're not adding any drugs to the product. No systemic effect. You're not IVing, let's say, like Wharton's jelly in a vein. You're putting it intra-articular, intramuscular. And homologous use. The structure and function of the tissue has to be similar or exact to the structure function of the recipient's use. So in this case, this is a scanning electron microscope of pre-processed umbilical cord tissue, Wharton's jelly. You can see the collagen-like fibers are almost identical to electron microscope image of your knee cartilage. Look at the strands. Okay, look. Now look at the post-processed Wharton's jelly. Still, the collagenous matrix, the cross-linked structures are preserved. So if you have torn, degenerated cartilage in your knee, it's very thin, the strands. So you can argue the Wharton's jelly collagenous-like fibers can provide structure and support and act as a conduit to torn structures like the degenerated cross-linked fibers in the degenerated cartilage knee. Okay? Yeah. Thus, homologous use. I don't see how you can get more homologous than that. Okay? And until they take away 361, this is the best evidence that you may use that in that respect. You just can't claim that there are cells in the Wharton's jelly and the metabolism of those cells are causing any change in the structure. So don't talk about the cell mechanism, talk about the growth factors, the structure, the histology, and then you'll stay out of trouble. All right. So depending on what you choose for your regenerative medicine, there are a lot of human cell and tissue products. Everyone has started with platelet-rich plasma. There is evidence that there are stem cells in your peripheral blood coming out of your bone marrow called V cells, very small embryonic-like stem cells. Theoretically, certain wavelengths of light could take them out of their quiescent or dormant state. We'd have to do a study with immunoassay staining to prove those cells do proliferate and what are the characteristics of those cells. But it is interesting that they have the potential to have the benefits of embryonic stem cells, totipotent. They can regenerate in any tissue, but hopefully not transform into teratoma or tumor. But the benefit is, obviously, they're not from aborted fetuses. It's your own peripheral blood. They're basically remnants of when you were an embryo, but they're just in a quiescent state. So these cells are very interesting. If we can somehow prove that we can activate them somehow and use it on the patient's own body, it's perfect because it's totally autologous. But they're, in Germany, they do regenikine where, they put it through heat to release the growth factors. And then umbilical cord blood, well, that has a lot of hematopoietic stem cells for, regeneration of blood cells and, vasculogenesis. Wharton's jelly, which we presented before, is great for, homologous use, such as supporting torn structures like, your cartilage. Bone marrow, that's really only FDA approved for liquid cancers, leukemia, but because of the low stem cell count, it's not ideal for our purposes. And then, of course, adipose tissue does a lot of MSCs, but, SVF, or if you're going to do, nanofat, that's what you're going to have to decide. And then it's funny because there's a group in California called Cell Surgical Network, Dr. Lander and Berman, and Dr. Lander is part of our academy. He's a member. So the FDA had an injunction and told him Telecell Surgical Network, they were manufacturing a drug when they were using collagenase with SVF. And so there was a lawsuit, and Lander and Berman won because the judge says FDA has no authority for a patient to use their own autologous fat stem cells on themselves. So that was a landmark victory for regenerative medicine, at least in California, but it's a precedent that I think SVF and NanoFed is pretty safe to use in other states. So that's a big victory for us, okay? I think I'm out, but there's a lot of stuff. Let me just, one more case. Oh yeah, it was great to be, again, we are in communication with the FDA. We have several meetings. I mean, Dr. Farshin has a great relationship from the director of CBER. Is he still director, Dr. Marks? Yeah. So they know we want to be compliant, but we're not going to sit there and wait till everything is approved or 351. We're going to operate under the correct guidelines that they established. So no other academy has a relationship with FDA CBER like us. All right. I'm just outlining the 361 guidelines. The next one I have to show, it's like the case of the century. I just got lucky. This is an 88-year-old patient with genu valgus, severe. You can see she's very knock-kneed, bone-on-bone right and left, scheduled for bilateral knee replacement. We injected 2 cc's of Wharton's jelly in each lateral knee with 6 laser treatments, 6, 25, 18. I want you to look at the circles before. Now let's look at the circles after. Let me see if I could, here you go. So you can clearly see the joint space has improved laterally in both. You can see there's less inflammation. You see the white signals before, it's less rough. And the knock knee is actually improved. I don't care what the x-ray looks like. I just got lucky on this. Because it wasn't even a Rosenberg view, but she can walk up and down the stairs without pain, and she canceled her knee replacements. 2 year later follow-up, 2 years later, still out of pain. So I don't care. You can't placebo that right there. Either there's increased joint space or not. Rosenberg view or not, you can't deny that. And look how smooth. There's no inflammation there. Okay. I just wish, yeah. Yeah, they are, yeah. It was straight on. And I like to do a weight bearing, not lying, because I want the full weight on it.
Weight bearing?
Yes, yeah. I didn't want to. Nope. Oh, what I did was I made a 5-degree lateral wedge, because when you make a 5-degree lateral wedge orthotics, it unloads the lateral knees. I'm sorry, medial. Medial wedges 5 degrees, look, and it will make the valgus go more straight. It'll unload the medial knees. Because orthopedic surgeons used to do osteotomy. They'd cut a 5-degree wedge in the tibia. That would make the lateral knee open up. But you can just wear the wedge. Okay, yeah.
Do you like wedges more than you guys?
Well, it's non-compliant, this big bulky thing. You're not going to wear that thing. Yeah, these wedges were developed by orthopedic surgeon. I mean, yeah, so as an alternative. So that's our presentation. I actually have more stuff to discuss, but thank you for watching the presentation. It's an honor. All right.